our usual intro type material, and then hopefully by the time he'll be able to join us and we can get going. Is everybody able to see my screen?
Looks perfect.
Good. All right, so my name is Brinda Dhanashekaran. I am with Jacobs, and I am so excited to welcome you all to this month's AZ Water virtual luncheon. So as you all might know, we used to have the AZ Water Technical Luncheon series. We used to have, a series throughout the year, every month or so. Once a month, we give a presentation, a technical subject, and we had a series going on in Tucson and one in Phoenix. This year, though, due to COVID, we've switched to an online webinar type model for all our committee presentations. And this is our fourth one this year. And we were expecting, we weren't quite sure how this is going to work out, but there's been a lot of interest from the AZ Water community, and there's been a good amount of turnout for these presentations, and that has been pretty rewarding for us to see. So I want to thank you all for supporting us and for joining the presentation today. And before we get started here, just a couple of housekeeping items. So this presentation is it qualifies for PDH certificates. So Shana Schwartz from AZ Water will be sending you the PDH certificates. If you don't receive them, feel free to contact Shana, and her email is listed here on the slide. This presentation is also being recorded and will be available in YouTube. So if you have friends or colleagues that are interested in the topic and would like to view the presentation, the link will be sent out by Shana, and I think it comes out in one of the newsletters. Isn't that right, Shana? Shana, you're muted if you're talking.
Yes, I am. Sorry. Yeah, same email address. Also, if you need it, and we do sometimes post them in our e-blasts. So, yep, sorry about that.
Perfect. And lastly, if your email has changed, or if you have others that could benefit from attending AZ Water events, please send their email addresses or your updated email address to Shana so she can keep the list up to date. Right. With that, this is our program for the webinar series this season. So again, this is our fourth. We started in September and we go through March. So we have a couple more topics coming up in February and March. But today's presentation is going to be on the ASU COVID-19 wastewater study, and Professor Rolf Holden from ASU is going to be our presenter. And typically for these webinars, we have one or two sponsors, and our sponsor today is Jacobs. So thank you, Jacobs, for sponsoring the presentation, and thank you, Professor Holden, for talking to us today. So as we get started here, as our sponsor, Jacobs has put together some introductory material about the company, and we have Roman Aguirre from Jacobs to go through those materials. So Roman, I can drive the slides for you here, and if you could talk to them, that'd be perfect.
Great, thanks so much, Brenda. Good afternoon, Arizona water community. My name is Roman Aguirre. I've been involved with the association for a number of years. Recently joined Jacobs back in November as the client account manager for Arizona for water and transportation. We've got a great opportunity before us serving the clients in Arizona. We realize that maybe there's a lot of people that don't clearly understand Jacobs, and so we put together a couple of slides just to give you a little background on our mission statement and our values. We're a global leader that's involved in the desire to solve complex water projects from concept to completion, and even through operations. We successfully delivered key projects and solutions throughout Arizona and look to continue to develop that further. Next slide, please. Our mission statement is challenging today, yet reinventing tomorrow. We want the most complex challenges. We've got just a depth of resources within our organization. I'm so familiar with Jacobs. I've been serving them as an account manager for most of my career and have traveled the globe and seen some of the amazing things that Jacobs is solving. But looking at tomorrow differently and trying to understand how we can make an impact in the world so that we can create more of a connected, sustainable environment. Next slide. Our values are key to us, and this has been very thrilling to become immersed in the Jacobs community, to understand that we strive to do things right, we challenge the accepted, we aim higher, and we live in a very inclusive society. Next slide, please. So when you look at the water portfolio, we're involved in conveyance and storage, water treatment, groundwater treatment, reuse, and reclamation. We're involved in water resources, wastewater, and the most exciting one I think is the digital water solutions that's becoming more and more important to our clients throughout the world. Next slide. So there's a couple of snapshots and some key projects in the recent past. We're involved in permitting, study, assessments, design, construction, operations, maintenance, both on the water and wastewater side of the market. Next slide. So this is the project that's underway right now is the Goodyear project, which involved not just the water treatment plant, but a challenging pipeline and pump station involved in design, build, and maintain. Next slide. One of the final statements I wanted to make was that I'm looking forward to reaching out and getting connected. I've lived here in Chandler for 9 years, but like I said, I've been involved with the association in this market for most of my career. And one final comment is we've recently posted 3 opportunities for project managers here in Arizona. If you know any friends or colleagues that are interested, have them reach out and connect with me. Thank you.
Perfect. Thank you, Roman. Right. With that, we are going to jump into our presentation with Professor Holden. So before we get started, I'd like to introduce Professor Holden to all of you. I hear a little bit of echo. Is the voice coming through okay for you all?
I think you're better now. I think someone was off mute, but I think we just fixed it. So keep going.
Okay. All right. Thank you. So Professor Holden is professor at ASU. He's also the founding director of the Biodesign Center for Environmental Health at ASU. He's also one of the founding directors for a nonprofit project called One Water, One Health, and a ASU startup company, Aquavitas. All of these, the Biodesign Center, the nonprofit, and his startup company have all been dealing with in the wastewater based epidemiology type work, and he's obviously a well-known expert in this field, and he talks routinely and gets invited routinely to talk to kind of the national policymakers, including the EPA, the CDC, the FDA. He also talks to members of Congress. He gets invited to talk to them. So very well-known figure, very accomplished. We are just so honored and thrilled to have you here today, Professor Holden. And one last note I would mention is that his book on the environment is the title of the book is Environment. If you haven't read it, it's a really good read. There's also a small video about his take on the environment posted on ASU's Biodesign Center's website. It's a pretty inspiring video. So if you'd like to check it out, please do so. With that, I will turn it over to you, Professor Holden, and we can see your slides. So I think we're off and running.
Thanks a lot for the opportunities to speak here. It's a great pleasure to be here and talk about wastewater-based epidemiology. as well as the role that Arizona is playing. So I'm going to make this a little bit Arizona-centric, forgive me, but we will visit most of the world in the talk too. So let's see what I can advance here. So before I forget and before I omit, I have to give my gratitude and thanks to all the various people that have helped. On this slide, you see just a small number of individuals. In the printed text, you see many names. There are too many to list, but I'd like to say that wastewater-based epidemiology does not work if it is done by one individual, one group, or one academic institution. It takes a collaboration between cities, health departments, academic groups, researchers, and even for-profit companies to get the most out of this technology. And I provide some examples here. I'm very grateful for the pioneers and the people who are willing to stick their neck out in Arizona and in other places to try this technology and see what it can do for us and where its limitations are. And these are thoughts that I'd like to share with you in the next few minutes. The history of wastewater-based epidemiology. How come that we see this now daily in the news and read it in every national and international newspaper? Is this really a new technology? And the answer is not really. We always knew that the excrements, the excreta of people contain markers of health. This is very old. It goes back to smelling urine, you know, in the old Roman and Greek times. But there was an understanding that we can, when we take the composited health information from people as expressed in, you know, urine and stool, that there is information in there, and that has been harvested for many decades, actually. In the early 2000s, people started talking at conference and say, hey, the mass spectrometry sensitivity of these instruments has advanced to a degree that we might be able now to measure the minute quantities of interesting substances that inform on health, on behavior, on consumption, and population health status. And the eye really was trained there at opioids. And the chemists were speculating at conferences that it might be possible to measure these and other health markers. And one person that does not actually run a lab or is a lab scientist took the time to write it up. And we often benchmark now the beginning of wastewater-based epidemiology with this first published report. But the truth is that we have looked for viruses, bacteria, resistance genes, and chemicals, and even radionuclides in wastewater much, much earlier than the 2000s. So it is an older technology, but certainly it has come to its fruition and bloom, if you will, in the current days. I think we all know how this works now. We all have to use the restroom. We deposit health information, you know, unintentionally, and it can be looked at. It can be looked at. It gets composited when it reaches the curb. At that point also, it becomes a common commodity. It is not owned by you anymore. It is owned by whoever happens upon the waste and can extract information. And it flows in our sewers, and more people get mixed and intermingled in at different places, and then it arrives at a wastewater treatment plant. And it constitutes an anonymized, composited sample that displays health information if you analyze it appropriately. We all in the wastewater business appreciate that wastewater flow actually varies. It's dependent on population. In areas where you have combined sewers, it is dependent on rain events and so forth. And so we know that we can't just work with a concentration. So we have to convert things and multiply a concentration with a flow that cancels out the units of volume flow, and then you end up with a mass per day. And if you happen to know the population, you divide by that too, and that gives you a per capita consumption or a per capita exposure of different things. And that's what we essentially have been calculating, more heavily so since the COVID-19 pandemic started. For those who are interested in images, so here's an example actually from the Valley of the Sun, opening sewers and then getting at the health information. Sometimes it's collected through manholes, sometimes through permanent sampling stations that have pumps integrated. The sample arrives, it is kind of a cloudy, murky, grayish water, not pleasant to smell, but not as bad as people often think. And you can then concentrate the analytes of interest and analyze them, whether it's by a chemical analysis instrument or a biological tool, such as a polymerase chain reaction or a PCR. And yeah, and then as you go through the calculations, you can determine health profiles. And it's interesting. So I've been doing this for over 15 years, and it was a complete backwater in science. Nobody really, people were typically laughing at what we were doing and shaking their head and were not believing that it was of any value. And so we had free kind of, we were able to roam freely and collect information. And we did this and created what's now known as the Human Health Observatory at Arizona State University, where we have in possession all the samples that the United States Environmental Protection Agency took during its sewage sludge surveys in years prior, as well as samples from hundreds of cities across the United States, and then even around the world, as indicated by the world map here. And this provides us with an opportunity to put the finger on the pulse of populations around the world and assess how they're doing, their health status, what they eat, what they drink, and whether they get exposed to things like antibiotic resistance genes, pathogens, or even COVID-19. Now, but let's turn to Arizona, which actually took a special role in a lot of different areas in wastewater-based epidemiology. So first, let's remember that it is home of the first and largest repository in the world for wastewater-based epidemiology, the Human Health Observatory at Arizona State University. But it doesn't stop there. Our group at ASU collaborated with the social scientists. And back in 2015, before we were doing any measurements on our city and our campus, we were asking questions to the community. And we were recruiting anyone from talking to police departments to utilities operators, to politicians, and anyone who was in public health agencies. Anyone who was willing to partake was invited for a 2-day workshop. And in this workshop, we tried to understand what the opportunities are, but also what the risks might be, envisioning how it would look in the future if you go to a party and you use someone's restroom and, oh my God, people can then assess whatever is in there. So we went through all these scenarios to gain an understanding and maybe also preempt some of the problems that can arise with a very rapid adaptation of a technology. So the city of Tempe was a pioneer in many ways, and I can't commend them enough for their willingness to really take risks for public health and to push, the envelope in public health surveillance as well as public health interventions and management. And so the city invited us to submit a proposal for innovation funds that were available to measure opioids. And I think if you look at what you can measure in wastewater, I think drugs are something that is particularly sensitive, right? Because aside from the possibility of you using this or a family member and that could implicate you with criminal action, there also is, of course, the concern that a community might be stigmatized, that it is a drug user or even alcohol consumption and so forth. So there's lots of reasons why this could be an issue. On the other hand, it is of course important if you have public health information to share it, to use it, and to improve public health, which is the ultimate goal of any public health agency. So the city of Tempe did this, and we started up an opioid dashboard. This is here, and this is another piece of history. This dashboard was launched in May of 2018, and it displays for the first time, as soon as the data are acquired, the concentrations of regulated, subscribed, and illicit drugs in the sewers of our city by neighborhood level. And so you see different areas here. We have shown 5 different areas. And here we see a urinary metabolite of heroin, 6-acetyl morphine. And so heroin is not used as a medication, so it is an illicit drug. And here we can see what the concentrations are by city area. This was really novel. A lot of people said this cannot be done, but it was done. It was done successfully. It actually has helped inform public health decision-making since 2018, since its launch. It was never abandoned, and it was actually expanded. And let me bring you some examples. So by 2018, we already had a public health surveillance system installed here in the Valley of the Sun, primarily with Tempe as the epicenter. And the city broken into different areas that started with 3 and then expanded into 5 and 7, plus the town of Guadalupe and other neighboring communities. In 2019, we said we could measure infectious diseases. We are not restricted to just looking at chemicals. And so we did that. and wrote it up as a, as a thought experiment, did some, collected some preliminary data and got it funded. And so we had a project for actually measuring infectious disease by example of the city of Tempe to, for the first time, demonstrate how you can create an infectious disease monitoring network. And so that's what we set out. We were in place in October of 2019. And then you know what happened. COVID-19 turned all of our lives upside down, changed every job description that was out there, put many people out of a job, put them into a depression and a state of economic distress. So there is just a lot of things changed. And that, of course, is reflected in the profile, in the health profile that can be read through the Human Health Observatory's view into the sewers. And so we decided to train our analytical devices to COVID-19. And we were among the first to do these measurements. The earlier measurements were reported in the Netherlands. And we had some data that were not published at the time, where we began to look at detection limits and the utility of this. And as soon as we had the assay, we put it up. And then the city followed up in bringing up this dashboard and created the world's first dashboard that displays real-time information, or near real-time as soon as data is collected, on a website for everyone to see on the concentrations of SARS-CoV-2, the virus that causes COVID-19. That's the world's first. It happened right here in the Valley of the Sun. And so we had the first measurements here. We saw very high levels indicating that, yes, this assay works, and it has a high dynamic range, giving us an opportunity to measure as few as 5,000 copies per liter and as many as tens of millions, depending on where we are. And we also saw that the initial lockdown was very effective with respect to controlling the virus on campus and in the city in various areas, as you see here. So all of these areas in the lockdown immediately went below the detection limit. And post-lockdown, we also saw that the increased mobility again allowed the virus to spread. We also saw the effect of the masks order. Wearing masks became mandatory, and that helped to bring levels down, and in many areas below the detection limit, until the fall semester kicked in. And then now we are in a continuing state of a pandemic that reaches ever higher levels. Hopefully, we will be able to cap it and return to a non-detect level very soon, but it will be very difficult since so many people are still spreading the virus and are infected, whether they know it or not. One example here is the town of Guadalupe, and this is very interesting. You see on the dashboard, you can go there, it's at covid19.tempe.gov, the world's first COVID-19 dashboard informed by WBE. And if you look here, there's an area 3, and then in Guadalupe. Area 3 is in green, and you see that the green area typically was non-detect. But if you look a little closer at the wastewater coming directly out of Guadalupe before it mixes with area 3, it had very high levels. These were actually, it was information that wasn't available because the zip code collapses Guadalupe and parts of Tempe. And so it was not obvious from the zip code that there was one area that was essentially non-detect and another one was carrying a lot of infections or cases, whether they were symptomatic or asymptomatic. And so we reacted by providing this information to the city. The town of Guadalupe very rapidly said, we want this information out, we don't want to sit on it. And together with Tempe, with Arizona State University and other resources, the health department, interventions were formulated and implemented that very rapidly brought the values down from over 1 million to non-detect. And so this is one of the early successes of wastewater-based epidemiology. So maybe let's stay briefly with the value and the utility of this. So the success of Guadalupe actually made the local news, where they said that Guadalupe was able to slash COVID-19 cases. Yes, the answer is yes, we can. But also, if we don't follow all the public health recommendations, then we are doomed to relive, some of these infections, because we need every measure that we have right now in the toolbox to control the virus. But it is possible, and the data from Guadalupe demonstrate how we can intervene and make a change. Let me also share some data here from an unidentified campus in the United States. This is one campus of of hundreds of campuses where measurements are being done, not only in the US, but around the world, where a lot of people realize they have authority over the acquisition of samples and the analysis. They have the tools for the analysis, and it becomes a public health tool to figure out what's going on. We see here, not surprisingly, as students return to a campus, they come from across the nation, and they increase in number, that we have more virus particles per liter of wastewater. Note here that this is not correct for population. And this is an important thing to do. If you have more people, obviously, then you have a higher number of overall virus particles in that sewer shed. But in order to actually observe trends and whether there are more infected individuals among those coming in, requires a normalization for the population. Another example here is a preview of things to come. Things very morbid, including the mortality of individuals that are not yet infected and don't know about it, and in the course of 3 weeks can lose their life over the infection. And so the virus is excreted by individuals upon infection at a time when they don't feel anything, regardless of whether they develop into symptomatic or asymptomatic cases. So there's a period of time where we are already shedding the virus and we are not aware. There's no way of really analyzing it other than with a clinical test, which typically is not available for everyone at every day to figure out whether we have acquired an infection. And so this presents then an opportunity to get a preview of things to come. And we see here that the shape of the detection of the virus is mimicking the mortality profile at this particular community. Moving on to wastewater-based epidemiology and equality and environmental justice. And we can stay right here in Arizona, where we know that we have significant environmental issues. So we have disproportionate exposures of populations to environmental agents, including to the Native American communities that live in our midst here in the Valley of the Sun, as well as in reservations and on our lands up north and down in Tucson area. So for full disclosure, so this is a non-profit project that I started with students at Arizona State University, where we thought this wastewater-based epidemiology tool is really helpful, but is it used fairly? Is it used equitably for all the people that have a need for it? And we felt that there are particularly communities that might endure a disproportionate amount of environmental stress, and they don't have the means to measure that. And you might think of communities surrounding maybe refineries down in Louisiana or Alabama, or maybe communities that are in uranium and mining operations here in our home state, Arizona. And so we created this nonprofit to help communities that can't pay and do the services for free. We were able to raise so far $500,000 and have served communities across the United States in providing free samples, free analysis of samples provided by these communities. If you know of a community, of a subpopulation that is at risk of being disproportionately exposed and that doesn't have the means to pay for these types of assays, whether it's COVID or whether it's a chemical exposure, please email our staff at onewateronehealth.org. And we will try to help you. One of the earliest stations where we began to sample and for COVID-19 was for Native American communities here in Arizona, and so this work is underway, funded by foundations to help the Navajo nations, where and other tribes where the infection rate can be as high as 25% right now. So these are really incredible numbers. Again, here's the contact information. You might want to email Nivedita at onewateronehealth.org if you're interested in this type of nonprofit work. Another thing about analytical assays is that they're only as good as a sample that you bring to us. And I think we in the wastewater field are very aware of different sampling strategies as well as different devices, and all of these have an impact on how good your data is. And so we realized early on that it's not good, for example, if you go to the movies, to only open your eyes every 15 minutes and take in a minute or two and then fall asleep again. you're not in a good position to judge what the feature film was about after 2 hours, and whether it was a love story or maybe a criminal drama or something else. In order to fully understand it, you want to see the whole picture, right? The whole movie. And so we devised instrumentation that allows us, and we patented it at ASU, and it actually became one of the pieces that allowed us to provide a startup company and services for Arizona and other places. And so as you use wastewater-based epidemiology data, I encourage you to think about what type of sample is here being used here. Is it a grab sample? Is it a 24-hour composite sample? And don't get fooled by the terminology 24-hour composite sample. A typical 24-hour composite sample collects about every 1 or 2 minutes out of every 15 minutes. So you have 4 to 8 minutes of chemistry out of a whole hour, and everything else that happened there you didn't catch in your sample, and then therefore the lab that you use, no matter how good it is, will not give you that information if it's not in the sample. And so answering to this need of bringing better analytical assays, more awareness of the sample quality and the sampler's use, as well as how to interpret data, ASU founded Aquavitas, a startup business out of biodesign, one of many that are settled here in the Valley. So Aquavitas is located in Scottsdale, and it provided a bid to the Human Health Services to be the company that essentially measures, oh, there's a typo here, COVID-19 across the United States for the Department of Human Health Services. That work is ongoing, and it will be expanded. If anyone is interested in becoming part of this with their community or their wastewater treatment plant, please email Patricia at aquavitas.com. This participation in this project does not require any resources other than just using the sampling equipment that is already in place and using the sampling containers and shipping labels that will be provided. So there's no cost, and all it takes for you is to send an email to Patricia to get the paperwork, get signed on. Maybe you can get right in, or maybe you can get on the waiting list. The sooner you call, the better your chances are of becoming part of this study that is funded by the Human Health Services of the United States. Now, wastewater-based epidemiology has expanded across the United States, and as you see on this map here, which is a snapshot, recent one, of activities, and it is not complete because not everyone who does these measurements actually participates in any one of the online dashboards. A lot of us are just busy collecting data, sharing it, and moving on with the science and public health interventions. There's some degree of coordination that is happening, including by the National Science Foundation. So we are funded with 3 other universities, in addition to ASU, through a wastewater surveillance network, a research collaboration network. And I encourage you to seek out this, this network for webinars that gives you the latest data from across the United States and around the world. And I like to compliment my PIs here, lead PI Carl Bibi, and then Alexandra Böhm and Heseth Delgado Vela. So how are we doing on time? I can venture on a little bit, or we could do some questions and answers. It really depends. So Brenda, what is your preference?
Sure. We have about 25 minutes left in our allotted time. So let's pause here and see if people have questions. And then if you could take those questions, Professor Holden, and if we still have time, we can move on to this topic.
Perfect, let's do it.
Right, folks, you have any questions for Professor Holden? Right, I do have one. I'll get started here. So what is the typical turnaround time, Professor Holden, to get the test results? So the samples get taken at the sewers and they're sent to your lab, and then what happens?
Yeah, and when you say our lab, so there's 4 different activities where we take in samples. But so let me give you the landscape. The assay takes a little bit of, first of all, the collection of a good sample takes 24 hours. So if you send a sample, it's already kind of a day old to start off with, okay? Then when the sample arrives at the lab, it takes at a minimum 8 hours to get through it with a typical quantitative reverse transcription PCR assay. There are assays that are take longer, and some of them are more sensitive. There's some that push the envelope now with new instrumentation, maybe it's making sacrifices with the detection limit. But let me give you a good estimate is that typically data do not arrive before 24 hours after the sample has been submitted, and that would be very fast. I can tell you that the Department of Human Health Services has set a turnaround time of 36 hours, which is a tall order at a high sample throughput. This is something that can be achieved as demonstrated by Aquavitas. So 36 hours, I think, is doable. Depending if you use PEG precipitation, a lot of assays really take 2 days to report. So the PEG precipitation assay can be sensitive, sometimes more sensitive, but it really can stretch the analysis time. I hope that's helpful.
Yeah, that is. Yeah, 36 hours is it's a pretty reasonable time for you to expect to get the results back. And just a follow up to that, just out of curiosity, is there potential in the future for individual testing? I know this is a wastewater composite from the sewers, but with the same technology, is there any applicability in using it at the individual level at homes?
Yeah, so I love that question because the obvious answer is yes, because what we do really in wastewater-based epidemiology is that we steal, if you will, we borrow, not steal, we borrow assays from medicine and apply them to composited wastewater to get information on average population health. We don't see outliers. If you have a chain smoker and 10 people who don't smoke, you get something in the middle that tells you, yes, there are smokers, but you don't know whether it's one heavily smoking individual or all 10 of them smoke 1 cigarette a week, right? And so this is information that we collect with medical assays. Is it cost efficient to go to your restroom and create wastewater and maybe then sample your own wastewater at the curb? Not so much, right? I mean, if you're interested in your personal health, you might just as well deposit a stool sample, which contains most of the virus, rather than a urine sample. If you're interested in chemicals, you would probably deposit the urine sample and get that analyzed. The costs are very similar, but the regulatory environment is different. For medical, so this becomes a medical HIPAA-governed activity if we analyze urine of an identifiable individual. Let me tell you why. Because if we run a sample on our mass spec, we can oftentimes see a lot of different chemicals. And we might see a marker that is of public health concern. It could be an infectious disease marker, or it could be maybe a susceptibility that tells us that this individual really needs help right now. And if we have if we can go back to the individual, we have an obligation to do so. And so this is all governed by HIPAA and the assays. The diagnostic assays have to be much more robust and reliable than the assays we can use in wastewater-based epidemiology. But overall, it's the very same technology. We use PCR for the most part. There's cheaper options, but they oftentimes are not as reliable.
Yeah, that's absolutely fascinating. Thanks for sharing that.
And Brenda, I'm not sure you can see the chat, but we have one other question that came in from Bob Hollander. He said, so I understand the Aquavitas effort better. This is an opportunity for interested parties to submit samples for analysis. If yes, what is the cost of analysis?
Zero. So if you send them to Aquavitas right now and you become part of the Human Health Services project, then the cost is zero. So that's I think the best answer you can get. It's a limited time offer, so again I can't emphasize the importance to get on that list as quickly as possible. But so you can get analysis done for free through the for-profit if it's a funded project, or through the non-profit if you are a community in need that doesn't have the resources. And that's onewater1health.org.
Perfect.
Great, thank you.
Shanna, are there any other questions in the chat?
I can see someone's typing, but it's the same person who asked the question, so I'm guessing it's a thank you, but just in case it's a follow-up.
I'd be happy to answer more questions, but I think there's still a few keywords here. If you allow for a few more minutes, I'd be happy to give some general comments on the aspects here, which I think are important for us as a society to look at and consider as we venture into this use of this new technology that is so rapidly transforming the way we assess health and the places where we apply it.
Yeah, absolutely. Keep going. We're good on the chat. I just wanted to make sure.
If you see a really cool question, feel free to let me know. So let's look at ethics and privacy. I think we oftentimes can kind of divide the population into those that are more driven by concerns and those that are more interested in opportunities and feel more comfortable with risk. But privacy is something that we should determine, and not someone else for us. Right? And so it is important with wastewater-based epidemiology to define at what point we are venturing into privacy issues. And it's not immediately understood. You could argue that as soon as you mix the excreta of multiple people, that it becomes anonymized. But really, if I sample the sewage pipe that comes out of a house at the end of a cul-de-sac, I know that's that household. And if I find a marker, let's say we find fentanyl, which we routinely measure, that's the drug that kills, most of the people that are covered under the opioid statistics of 70,000 deaths per year in the United States. That is a public health concern. We need to do something about it. We can go to that address and inform the people. So there's an issue here. Another thing of ethics, and people often don't appreciate that. They say, oh, there are risks, and therefore let's not do it. But I think that we also have an obligation, if there is a way of assessing health threats, and if the knowledge of that information can transform, protect, or even save lives, then I think we have an ethical obligation to get these data out. And I have to say that in all of the entities that I work with, whether it's for-profit to non-profit to education, I'm really struggling with this boundary of I have information, I'd like to share it, but there are obstacles of sharing it. And I know that the information could transform the health status of a community, and it could eventually save lives. And so this is a difficult landscape to navigate. It goes into data sharing. So the fact that we can do it and that we do it doesn't mean that it's used to the full extent. The real value of this technology, and also an early appreciation of its limitation, can only arise if we share the data very broadly with everyone, so that more eyes get on it, and we can understand, how it works, how it doesn't work, where the limitations are, where the benefits are. And that is not happening all the time. Tempe has been, the city that has been the most forthcoming with this. The city of Phoenix, similarly, I commend them for, doing these measurements and really, moving around by sharing the data more openly with others. They have spilled over into Tempe, so they are now the two sister cities here or adjacent cities are able to compare their values and interpret them. So there's much to be learned by data sharing, but also there are concerns. And they, I think, relate then to the last issue here, science and politics. It's not science and policy, so I actually going to talk politics. I know I'm going to get into hot water for that. But really, we shouldn't. We should be able to talk about science, and we should be able to talk about politics. Now, politics are something of both conviction and, and how you value things. But science is something, no matter what party affiliation you have, the scientific data should be all the same. And I think this is something that has changed in the past years, and we need to go back to understand and interpret science for what it is. It is naked information. When we first posted the data for COVID-19, for SARS-CoV-2 in wastewater for Tempe, we were agonizing on how to present the information. In the end, we said, let's be conservative. We report a physical measurement, a virus particle migrating through a monitoring location. That is reality, right? It's like temperature. You put a thermometer out, you make sure that it works, and it reads the temperature. That is reality. Now, what causes that temperature, whether it's a Bunsen burner that somebody holds there, or whether it's the Arizona sun heating it up, that is something that you need to figure out. But a physical reality is that it is hot. And similarly, if you got a hot sewage sample that is loaded with SARS-CoV-2, that is scientific, robust information. Now let's move to politics. Politics is how you operate and use information, right? And a good politician gives you, a road map to where we want to go, as well as evidence on why that is a good idea. Now, where we want to go is a question of how we value the economy, how we value individual freedom, and how we value population health. And that is a matter of the party. But what we need, really, is politicians that have the backbone to say, look, we all operate from the same data. This is the data. And this is how we value things. And for that reason, we are making these decisions. What is not, admissible and good for the purpose of public health is to either suppress data that don't fit the narrative politically, or to manipulate data, scientific data, so that people lose their trust into science. And so we cannot go there. We have to agree on a scientific platform. And one more thing, I believe that anyone who makes a decision in COVID-19 will always make a mistake, because you cannot please all the entities. So whoever the poor person is who has to make a public health decision, it is a very difficult place to be. You can't please all. You will always have critics. That is just a reality, no matter where you are on the political spectrum or the public health spectrum. So it's very complex, very difficult. I would just love to see a little more of a separation of where we move from robust data we agree on to the political interpretation that will allow us to add preferences, priorities, and then come to different roadmaps, completely different solutions, maybe that are based and founded in the same data. I'll leave it at that and reopen the floor for questions.
We did have one in the chat again. Is ASU in communication with ADHS with some early warning of potential COVID-19 cases in a given community?
So ASU has been very active in doing not only the wastewater, which has popped up in the newspaper quite a bit, but also the clinical assays. So ASU is serving its own population by doing clinical testing on a repeated basis of all the people that are on campus, as well as for communities. ASU has helped to coordinate, inform, and is now doing measurements for Tempe and other residents of other cities here in the Valley. So there is a lot going on, and I can't even, I don't know about all the activities, but the answer is certainly yes and yes. So ASU is doing wastewater work and it's doing clinical work, and there's a lot to be done, and it's amazing. I think it's inspiring to see how much the university has stepped up and taken on things that looked impossible. When we look at the science initially of wastewater-based epidemiology, and then scale it up and bring it to the community to help overcome the pandemic.
Great, thank you. The chat is clear. If anyone else has questions, you can take yourself off of mute or type into the chat.
Right, I guess we have no more questions, but this was a fascinating presentation, Professor Holden, and definitely some good food for thought in that last slide that you presented. So I'm sure people are thinking about what this means to them, and thank you for talking to us about this and sharing your wonderful work, and good luck to you for all your future work.
Brenda, it's been a great pleasure to be here to present the privilege, and I'd just like to applaud the entire wastewater worker community, the public health departments. It's a tremendous work done under tremendous stress, and it's amazing what has been done, and I'm confident that we will be able to manage this pandemic and move on, and then use wastewater-based epidemiology to prevent future pandemics and just to be more ready and prepared and do public health protection rather than healing of inflicted wounds and exposures that already have occurred. So with that, thank you, and give it back to you. Bye.
Thanks, everyone.